Thank you so much, everyone, for joining us this afternoon, Nairobi time. My name is Davis Adieno. I'm the Director of Programs at the Global Partnership for Sustainable Development Data, and I'll be moderating today's session on using citizen-generated data to address drug-resistant infections in Kenya, also known as antimicrobial resistance, but as we popularly know it here in Kenya, antibiotics resistance. The Global Partnership for Sustainable Development Data is a global network that brings together governments, multilateral agencies, citizen-led organizations, civil society, research academia, private sector companies, and many others who are primarily concerned with how data can support the delivery of the sustainable development goals. But I would also like to point out that at this point that we do have Swahili interpretation. So for those who prefer to follow the session in Swahili, please go ahead and click on the interpretation button in your Zoom application. We'll also be sharing live on Twitter. So for those who are active on Twitter, we are using the hashtag #StopSuperBugs. Stop super bugs, and the bugs is not the one for carrying your laptop, is the bugs of BUGS. So we are using hashtag #StopSuperBugs, one word. Thank you so much to everyone. We really look forward to an exciting session with all of you. But at this point, I'd also like to welcome some of our speakers today. And we're grateful that you could find time to join us this afternoon. Special thanks to Dr. Rashid Aman, who's the Health Chief Administrative Secretary, or CAS, at the Ministry of Health here in Kenya. Thank you so much for joining us. Dr. Simon Kibias, who's the Acting Head of the Directorate of Health Standards, Quality Assurance and Regulation at the Ministry of Health here in Kenya also. We're grateful to Professor Sam Kariuki, who's the Acting Director General of the Kenya Medical Research Institute, KEMRI, and Mr. Benjamin Abusebwa, who's joining us from the Kenya National Bureau of Statistics and is the Director of Statistical Coordination and Methods. Given that we will be having simultaneous translation in Swahili, I would encourage the speakers to speak moderately slowly, but not too slowly, so that our interpreters can also have an easy time translating some of the key messages that will be coming from the different presentations today. That's a brief agenda that we have. We are going to have some welcome remarks, and then we'll be presenting the findings of this joint work between the Global Partnership for Sustainable Development Data, Africa's Voices Foundation, and the Ministry of Health and other partners who have been instrumental in supporting this work, in particular the Wellcome Trust for the financial support that made it possible. We'll also have a keynote speech and a panel discussion, questions and answers, and we'll wrap up with some closing remarks. And at this point, I would like to welcome Samuel Kimeo from Africa's Voices Foundation to give his welcoming remarks, and we can kick it off from there. Thank you so much.
Thank you very much, Davis. A good afternoon from Nairobi. Africa's Voices was privileged to work with GPSDD, and welcome on this piece of work. And Africa's Voices is an organization that is dedicated to placing the voices of citizens at the center of decision making. We do this through a combination of mass media, where we create interactive radio shows. And I would like you to think about it as placing the town hall meeting or the baraza, as we call it in Kenya, from the physical space into the mass media space. But we don't just do that for purposes of entertaining, informing, and educating. We do that also as a research option that we've developed, or has been developed for us by Cambridge University. We infuse a shortcode, an SMS shortcode, where citizens can respond to questions, ask questions, and get answers from the duty bearers. And once they do that, we harness the SMSs and we analyze them using this social science method. So we get qualitative and quantitative data. We were privileged to work on this piece on antimicrobial drug resistance, which is an important subject, pretty much the pandemic that flies under the radar. We used our methodology to get citizens to interact with experts from the ministry, experts from the livestock department, and also other citizens to come up with views that help us understand what the understanding is, what the knowledge levels are, and what citizens think can be done to deal with this issue of antimicrobial resistance. We, of course, our methodology can be used for any other purpose, but certainly we plan to continue engaging in this space and to work with you and anyone else who is interested to work with us to not only popularize this methodology, but also to continue create platforms for engagement of citizens with the authorities and decision makers. For this is important because everything we do in the name of the citizens, and the citizens have a right to be heard, but not just a right. But I do think that our work cannot be holistic, and we cannot achieve our objectives if we don't understand what citizens are thinking about any one particular issue. Thank you very much. Over to you, Davis.
Thank you so much, Samuel, and we are grateful for this particular partnership and all the amazing work you did to make it possible and bring to life some of the citizen voices into this particular conversation. We are going to have a very short video, ladies and gentlemen, that will be played shortly. And then after that, we will go into the presentation of the findings. Do look out on the chart for some directions to the Slido poll, and also you can post some of your questions. The Slido poll would allow you to also post some of your questions. So over to you to run the video. Thank you.
Sasa hivyo unapewa yani nimepewa hizo dawa mara nyingi, maana anagonjeka tu kila mara anagonjeka. Sasa ukienda unakwambia ni infection, wengine unakuja kumpea still bado anatumia, anafanya kafadhali, alafu inamrejelea tena. Na pia wakati mwingine nilikuwa anaweza gonjeka usiku, nikachukua dawa kwa jirani hivyo nikampea. Kwa sababu nikimwona anaendelea vizuri kama hivi ninaacha. Nikija wiki moja anarejelea tena kukohoa.
Antimicrobial resistance is basically a situation whereby an antibiotic that was previously used to treat a given infection can no longer be used. Whenever you do not use antibiotics as recommended by the doctor, what happens is that the bacteria that may have been in your system, in your body, is not killed. Then they learn how to fight an antibiotic. So it ends up that it cannot kill that bacteria, which then causes more severe illness, more prolonged illness.
You need multiple ways of addressing the problems, especially at the level of the citizen. The challenges of access are real. The challenges of affordability are real. The challenges with regard to availability are also real. And these are critical for us to combat AMR.
Ningependa kuelimisha jamii kama vile mimi nilivyoelimika kuhusu kutumia madawa. Kwa madawa ukipewa inafaa uyatumie kama vile daktari alivyokuelezea na umalize dozi, usiache dozi katikati, na uhakikishe ukisikia chochote kwa utofauti wote kwa mwili wako uone daktari.
Thank you so much for that short but very educative video. Ladies and gentlemen, at this point in time, would like to engage you a bit more. Instructions have been shared on the chat for you to access the Slido poll, and we'll be doing this in about 3 minutes. Would like to very quickly engage you. We have a short poll that we want your input with. And the poll is basically, and the question that we are asking you is basically, what is the first word that comes to mind when you think about antimicrobial resistance, AMR? What is the first word that comes to your mind when you think of antimicrobial resistance? Please join the Slido poll at slido.com. We are seeing superbug coming up. Antibiotic misuse is number 2. That is the number for joining the slido.com poll, 954-271. Lack of awareness is the other. Misuse of drugs, poor data, overconsumption. Any others, please join the poll because we'd like to hear from you. Before the presentation is made of the findings. Superbug is standing out. Any other chasers? Let's see. Misuse of drugs is looking good. Dispelling myths. Long recovery period is also making a showing here. Lacking understanding, limited knowledge, overconsumption. Keep those coming in. We do have about 2 minutes. Untreatable, over-the-counter drugs. Fantastic, keep them coming. Which words or word comes to mind when you think about antimicrobial resistance? And now water quality, water pollution, environmental pollution. Untreatable, lack of awareness is standing out. Misuse of drugs, some of you are also sharing on the chat. We'll consider those valid votes for this particular poll. Antibiotics misuse is so far leading, lack of awareness, misuse of drugs closely following. Untreatable is coming up, superbug is coming up. Let's see who's going to be the winner here. We have about another minute to do this, everybody. Yeah, Anthropocene, I haven't heard of that one. Interesting. Death with exclamation mark. Poor regulation, poor language. Gonjwa sugu. Gonjwa sugu is a superbugs. Keep them coming. We have another 30 seconds to do this. We are nearly there, ladies and gentlemen. Thank you so much for your responses. Antibiotics misuse is so far standing out as the leader. We have misuse of drugs, lack of awareness, untreatable. Any other votes? We are not leaving anyone behind. Antibiotics misuse is still long recovery period, structural issues, repeated treatments, cross-contamination. Next, pandemic, very important. Pandemic, over-the-counter drug. Limited data, we've seen that already. All right, we are now, we'll be moving on to the presentation, but we have Viini Sugu, which is superbugs. All right, fantastic. Keep polling as we continue the discussions. And at some point we'll be announcing the final winner. But at this point, ladies and gentlemen, antibiotics misuse, untreatable misuse of drugs, lack of awareness, in that order, these are the words that come to people's minds when we talk about antimicrobial resistance. Keep them coming, but at this point in time, I'd like to welcome my colleague Karen Rono, who's going to be sharing the findings of the work that we did in partnership with Africa's Voices Foundation, KEMRI, the Ministry of Health, and other partners. Thank you so much. Over to you, Karen.
Thank you so much, Davis. And I think the slide up will reach for the findings, because I will take about the next 7 minutes to share the findings in 3 slides. I think understandably, AMR is a global problem. The video has told us that, and the data is also telling us the same. It's estimated that over 700 people die every year around the world due to drug-resistant infection. AMR is a global problem, but it's also a data challenge. And I saw this in the slide of Paul just now. So I'm going to take you through the findings in the study that we carried out with Africa's Voices, using the methodology of using interactive radio to gather feedback from citizens around AMR. We wanted to understand, what do citizens know and what should they be doing around antimicrobial resistance and their behaviors towards AMR. So the slide showing now is on the methodology, how we did this. We carried out 10 weeks of interactive radio in 3 locations, Kiambu, Bungoma, and Kilifi County. The radio shows were very deliberate. We had a guest in station talking about AMR and interacting with the citizens via free SMS shortcode, asking us specific questions, such as AMR is a problem. What do you know about AMR? What should you be doing about AMR? What are your behaviors around misuse of antibiotics? So the 38 live interactive radio shows were broadcasted in Kikuyu, Kiswahili, and Luya language. So there was also the challenge of breaking down AMR into local languages. Over 1,000 texts, which we analyzed to get us these insights that we are presenting today. For the listeners who could not, or for the citizens who could not get to listen to the radio show live, we hosted listening group discussions where we bring in a small group of people to listen to the show together, the recorded show, and then have a discussion around the topic of the day. We also had some key informants with key policymakers in these locations. Can we move to the next slide? So in terms of findings, really, we group these findings as the drivers of antimicrobial resistance. And we see this as a bucket of system issues, but also a bucket of behavior or citizens' attitudes and behaviors around antimicrobial resistance. The 6 key drivers we found were ultimately, the first one is the practices that we as people or as citizens do to propagate AMR. We call them risky. Sometimes we take antimicrobials too soon, even when we don't need to take it. And I know the COVID pandemic has been a real experience of this. Or sometimes we don't even take antibiotics or get a prescription or even go to the health facility. And why is that? There are the challenges of accessing health facilities, affording, and those facilities being available. We also found, the health services being under-resourced or inadequate in some instances. When citizens or people visit the health facilities, there's a tendency to feel that the guidance that they received is not detailed enough to make them actually realize, so what I'm doing is wrong, or what I'm doing is not the right way. Guidance on how to take antibiotics, when to take antibiotics, not to share antibiotics with family members, not to buy antibiotics over the counters. Those are guidance that if citizens had as detailed guidance from the health facilities, then it would help to change their behaviors. There's also a perception around the quality of medication and the level of misinformation out there around, a generic drugs or a generic antibiotics of a lower quality, of a poorer quality than original medication, and things like that. Lastly, around enforcement, this came up really strongly. It's one thing to have these enforcement measures in place. It's another thing to implement them. And we found that while there's enforcement in place, the awareness and really bringing this enforcement or these regulations into place is limited. And I'll actually share an experience I had this morning. Someone from the county government of Nairobi calling me and telling me the enforcement is a challenge, especially in these times of COVID, where people know what they want. People know they need antibiotic, and they go and buy it, and they're not turned away when they visit the chemist because they can get the antibiotic without a prescription, without any guidance. Anyway, findings aside, I will talk about the recommendations. So what are we saying around citizen-generated data and the use of this in AMR? First, citizens definitely should take a role in changing their practices on accessing antimicrobials, but also removing or curbing the misinformation that is out there. There's a role for policymakers around investments in AMR, and also prioritizing public health as a key area which can help us to curb antimicrobial resistance. And I think the importance of citizen-generated data really cannot be underestimated. It's data that brings the voices of citizens. It's very participatory, and citizens give their view around the issues that concern them. And I see this helping to complement official statistics that we generate through surveillance systems and laboratory infrastructure. So CGD actually helps to close the gap and collect data in areas that surveillance data will never enable us to capture. There's the importance of quality patient engagement, as I mentioned in my findings, that how do we guide or provide even more detailed guidance so that patients can learn and know what are the things that they're doing to propagate AMR, and what should they be doing to change their ways. Lastly, incorporating the voices of citizens in research studies. And I'm actually looking at the research community in AMR in this recommendation, that using such methods really help to complement the ongoing efforts to generate data, so that we have a richer source of data. But as we do that, we're also ensuring that we are working with the citizens and working with people along in tackling AMR. Davis, that's the end of my presentation, and back to you. Thank you.
Fantastic. Thank you so much, Karen, for that quick presentation on some of the findings. Ladies and gentlemen, do remember that you can share some of your questions in the chat, but there'll also be an opportunity for a Q&A much later. I'm shortly going to turn to the Ministry of Health, but I just wanted to say that, when it comes to AMR, some of the issues that are being highlighted here don't live too far from some of us. Last year, my dad was quite unwell, but one of the problems that emerged when he was being examined in hospital was the fact that he had pretty much abused a lot of over-the-counter drugs. And so one of the things I'm going to do is to take to him the findings of this report and share the knowledge. He's changed his ways as it is at this point in time, having seen the dangers. But just to say, it is a serious problem that requires all of us to pay attention and to take some form of action. I'm now going to turn to the Ministry of Health for some remarks, and I will first invite Dr. Simon Kibias, who's the acting head of Directorate of Health Standards, Quality Assurance and Regulation, the Kenya Ministry of Health, who is then going to invite our chief guest, Dr. Rashid, the Chief Administrative Secretary, to make some keynote remarks. Thank you so much and welcome, Dr. Simon Kibias.
Thank you. Thank you so much, Davis Adieno. I would like to recognize the presence of our Chief Administrative Secretary, Dr. Rashid Haman, and recognize the representatives of the Ministry of Agriculture, Livestock, Fisheries, Cooperatives, and other ministries, departments, and agencies like KEMRI, Kenya National Bureau of Statistics, development partners, and UN colleagues, distinguished guests, ladies and gentlemen. I'm delighted to be here today to support the launch of this report on using citizen-generated data to address drug resistance infection in Kenya. First of all, I would like to express my sincere gratitude to the teams and development partners that have tirelessly worked to ensure the success of this meeting. As you may have noticed, the representation in the attendance is multisectoral and multidisciplinary, pointing out that no single sector can effectively address this global threat and the need to tackle AMR from one health approach using evidence generated to inform action from frontline professionals, policy decision makers, and the public. Distinguished guests, we are here today because the increase in organisms showing resistance to commonly available antibiotics has rendered standard treatment ineffective and facilitated the spread of drug-resistant infections, leaving communities vulnerable. To ensure that we continue to benefit from antibiotics, practical approaches to the use of both existing and newly developed antibiotics are essential. As you are aware, the COVID-19 pandemic has challenged all aspects of healthcare, including both recognition and management of serious acute bacterial infection and effective delivery of healthcare services, including antimicrobial stewardship program globally. We have seen that most COVID-19 patients in the hospitals are being treated empirically with broad spectrum antibiotics, and the public resorting to self-medication with antimicrobial agents in the absence of proper diagnosis. Because of the widespread use of these antibiotics, the patients are more susceptible to develop infections with AMR organisms. Ladies and gentlemen, we recognize that the battle against infectious diseases and threats such as antimicrobial resistance require resilient health systems, which call for long-term investment in key elements, including an educated public, adequate number of trained health workers, robust health information system, including surveillance, appropriate infrastructure, sufficient financing, and transparent financial management systems, and a strong health governance system that ensures quality and accountability. This calls for strengthening our collaboration across sectors and leveraging multiple platforms to achieve desired goals. Distinguished guests, it is always easier to prevent infections than to treat infections, so implementation of well-established infection prevention programs is essential for successful antimicrobial stewardship programs. Additionally, the judicious use of antibiotics should be guided by data collected nationally and at the counties and enforced by rigorous stewardship programs. With this in mind, and recognizing that as a country, we will still have a lot of ground to cover, the Ministry of Health has implemented the following joint national action plan on AMR. 1, establish a national and county multi-sectoral coordination mechanism to support the implementation of national action plans, and also improving awareness and understanding on antimicrobial resistance. We have effective communication, education, and training. There is a joint developed national AMR communication strategy with the Ministry of Agriculture, Livestock, Fisheries, and Cooperatives. In November 2018, and consistently worked with the World Antimicrobial Awareness Week, as this week is launched. This week we launched the pre-service training on antimicrobial stewardship. In strengthening the knowledge and evidence base through surveillance and research, the national AMR surveillance strategy and national training modules have been developed with 19 laboratories in human and animal health surveillance system put in place. And in order to reduce the incidence of infection through effective sanitation and hygiene infection prevention measures, we have an active IPC program, which is implementing the national IPC policy, strategy, and guidelines. And in optimizing the use of antimicrobial medicines in human and animal health, we have developed and implementing guidelines on prudent use of antimicrobials. And on reviewing regulations and legislation, there is an ongoing measures to ensure compliance by enhancing the enforcement of the laws developed to regulate and legislate on the use of antimicrobials. And in order to support accountability and tackling of interventions and impact, there's a joint monitoring and evaluation framework for AMR National Action Plan in place. While we note and appreciate the significant steps taken in setting the systems and subsequent implementation of the National Action Plan, greater collaborative efforts are required to mobilize resources to fully implement the National Action Plan in multiple sectors across different levels of government. Ladies and gentlemen, I'm particularly drawn to the fact that the use of innovative methods like radio not only entertains, but it informs and allows citizens to give their views on the issues that concerns them, and that the organization can analyze this huge amount of data and make the useful meaning out of them to the policymakers, and also to ensure that action is taken. In addition, the insights highlights that as a government, we still need to increase our efforts to tackle AMR and prevent the misuse of antimicrobials. Like every novel issue, the National Action Plan has enabled us to learn more, and we want to take these lessons to the development of the next National Action Plan. Of importance has been the role of the general public, ordinary citizens' voices in tackling AMR. Without them, we will never fight AMR effectively. This study has really made it clear what citizens know about AMR and what are their current practice and what we all need to do about it. A collaborative effort is important, which is the spirit of the One Health approach. And going forward, I encourage organizations to join us in the efforts to close these data gaps through the use of other complementary sources of data, including citizen-generated data. In conclusion, the Ministry of Health wishes to acknowledge the technical and financial support provided by tripartite WHO, Organizational of OIE, FAO, USAID, UK Fleming Fund, CDC, REACT, Wellcome Trust, and all other stakeholders. Thank you very much for listening. Having said that, I think it's now my humble pleasure and singular honor to welcome our Chief Administrative Secretary, Dr. Rashid Aman, to give his speech. Thank you.
Okay. Thank you very much, Simon Kibias. I would start by recognizing and acknowledging the presence of representatives of the Ministry of Health the Ministry of Agriculture, Livestock, Fisheries and Cooperatives, Government of Kenya State Departments and agencies, the Kenya Medical Research Institute and the Kenya Medical Research Institute Wellcome Trust Program, Wellcome Trust, the international community, AMR stakeholders, distinguished guests, ladies and gentlemen. It is indeed a pleasure for me to be here today, participating in this important event, which comes at a time when the world is preparing to commemorate the World Antimicrobial Awareness Week 2021. This indeed is an event with a difference and a great milestone because Kenya is honored to have taken part in this project that has actively and deliberately engaged citizens to contribute to the policy development and implementation process. It is indeed a privilege and a sign of recognition of the country's commitment to fight against antimicrobial resistance. First of all, I would like to express our sincere thanks to the teams led by the Ministry of Health and the Ministry of Agriculture, Livestock, Fisheries and Cooperatives and development partners for their contribution to the government's response to antimicrobial resistance, which I continue to follow with great interest. As you have heard, AMR is one of the most complex public health threats with root causes in multiple sectors ranging from health, food safety and agriculture to environment and trade. It presents the global, regional and national communities with extensive challenges considering its depth and breadth. Studies have predicted a continued rise in AMR globally, leading to 10 million people dying every year by the year 2050, if we continue at this rate, and a reduction of 3% in gross domestic product by the same year, 2050. This indeed can easily reverse all the gains made in the fight against infectious diseases and threaten advancement in modern medicine. In addition, with the increasing levels of international travel and trade, AMR is one of the biggest threats to global public health, food security, and development, and if left unchecked, will greatly hamper the achievement of the SDGs. The complexity posed by AMR in essence means that no single government, department, or independent organization can tackle it alone, and that containing, controlling, and preventing emergence of AMR demands engagement and well-coordinated actions across multiple levels, sectors, disciplines, and with a broad range of stakeholders, citizens included. A statement that is validated by the very nature of the report that we are about to launch today. From the reports of the situation analysis, Kenya is no exception to this threat, with increasing rates of antimicrobial resistance being reported in our hospitals and communities. Operational research conducted on public awareness in 2019 revealed that the levels of awareness on the dangers of AMR were low, with 73% of members of the public interviewed indicating that they had never heard of the AMR Awareness Week, and 71% of those interviewed indicating that they trusted doctors who prescribed antibiotics and would be willing to move to an alternative if one of these doctors refused to prescribe an antibiotic. This is a clear pointer to the enormous task ahead of us in advancing the AMR agenda. And personally, I would be very curious to find out whether this perception, which was obtained in 2019, has changed today. So perhaps the challenge is for the AMR team here to go back and get a feel for what the public think about AMR. In response to this, the MOH, in partnership with the Ministry of Agriculture, Livestock, Fisheries and Cooperatives, joined the concerted regional and international efforts to reduce AMR and ensure the availability of effective antibiotics now and into the future. In response to the AMR threat, the two ministries consolidated national efforts to implement sustainable measures to mitigate any further emergence and spread of AMR. Using this One Health approach, the ministries developed the policy and national action plan on AMR, and the implementation of the policy is well underway. And I take this opportunity to thank the lead ministries and implementing partners for the support provided towards achievement of the set goals. Taking into consideration the complexity posed by AMR, implementation of national action plans is not an overnight success. It requires functional and integrated systems with well-coordinated, appropriately resourced governance structures to successfully and effectively implement the interventions in the national action plans. The government has, as you have heard, has taken several measures across various sectors to intensify action against AMR, including the implementation of the National Policy and Action Plan on AMR and the accompanying strategies on surveillance, communication, infection prevention and control, and antimicrobial stewardship. All of these actions will go a long way towards addressing the challenges identified in the situation analysis on awareness, surveillance systems, IPC, rational use of antibiotics, and research and development. As much as there is still a lot of ground to cover, we acknowledge great progress that has been made in each of the policy objective areas. In advocacy and awareness, we have consistently commemorated the World Antimicrobial Awareness Week alongside numerous CPD activities. Our national AMR surveillance system is now well established with 16 laboratories, 10 human health, 6 in animal health, in a network up from 2 in 2017 when the policy was launched. During the response to COVID-19, the ongoing COVID-19 pandemic, we have scaled up IPC interventions, a key aspect of reducing the need for antimicrobials. In view of the COVID-19 pandemic, several studies globally have indicated a high rate of antimicrobial prescribing and self-medication for those with symptoms of COVID-19, and we know much of which is unnecessarily promoting AMR, as most of the initial illnesses being treated have been from COVID-19 viral infection. Optimal utilization of microbiology laboratories is critical in ensuring that the continuous engagement of patients, the clinical and laboratory teams supporting the judicious use of antimicrobial agents continues as guided by our stewardship guidelines. We need to continue with the efforts that we have put in place. We need to continue with identification and allocation of government resourcing of the National Action Plan to ensure effective implementation, communication, coordination, monitoring, and evaluation of the multi-level interventions. This is critical for sustainability of partner-supported interventions. The commitment and growing interest in supporting the implementation of the policy by development partners, such as the CDC, USAID, FAO, WHO, OIE, REACT Africa, World and Animal Protection, the UK Fleming Fund, and now the Global Partnership for Sustainable Development Data, is a strong indicator of willingness to work together with government to realize the goals of policy and maximize on the results for the benefit of Kenyans, men, women, and children in a sustainable manner. We also need to continue to sustain the commitment and interest in supporting the implementation of the policy by government alongside its development partners in order to realize the goals of the policy and maximize on the results for the benefit of Kenyans. We are fully aware that no single government department or independent organization can tackle AMR alone, and that containing, controlling, and preventing the emergence of AMR requires working together working in networks in a well-coordinated way so that these actions across multiple levels will yield fruit. With that, I would now like to laud the efforts of the Global Partnership for Sustainable Development data in highlighting that AMR is everyone's business, everyone's priority, not just the government, but the citizens and the research community. This Antimicrobial Awareness Week, which is upcoming, reinforces the importance of having everyone on board for us to tackle AMR. Its theme, Spread Awareness, Stop Resistance, is the true spirit of why we are gathered here today and what we aspire to do in the global and national action plans. We cannot fight resistance if people are not aware, empowered, and if they do not take action in making the right decisions. Often, policymakers can develop great policies and try to implement those policies, and in many cases, forgetting the general public. The general public must be reached, their views must be sought, and they must be educated on issues that concern them. Everyone can and should be an AMR champion, and by people we don't just mean the technical experts, we mean ordinary citizens who make daily decisions that affect their health. Because data is a key tool for our decision-making and action, we sincerely appreciate the findings from this study from Global Partnership and Africa's Voices, and encourage non-state actors to generate similar robust insights to guide our decision-making. We value the complementary data that we would otherwise not be able to generate ourselves. I also recognize and appreciate the efforts of the Kenya National Bureau of Statistics, the efforts that it is making to provide quality guidelines for producers of data outside the government official systems that provides additional perspectives to the agenda at hand. As I conclude, I call upon sectors and stakeholders to work together in a collaborative manner to give the government of Kenya all the necessary support to enable us realize these goals. Indeed, the central role of data to address AMR cannot be overemphasized. Surveillance data is important, and so is data from citizens on AMR. I reiterate the government's commitment to implement the policy and emphasize the crucial role that governments play in the coordination across multiple actors, because collaboration is truly the heart of this joint venture. We all have a role to play, and I challenge each and every one of us to make a difference within their space to preserve the existing and new antimicrobials. With these remarks, it is now my singular honor and privilege to launch this first report on using citizen-generated data to address drug-resistant infections in Kenya 2021. Thank you for your kind attention. Over and out.
Thank you so much, Dr. Aman. In this virtual world, we still applaud those very rich remarks and highlighting all the critical issues. Same to you, Dr. Kibias. We really appreciate your speech and highlighting the seriousness with which the Kenyan government is taking this issue through the development of the action plan and its various components. You put it very well, Daktari, that no single entity is capable of tackling this particular challenge, and that it's everyone can and should be an AMR champion. There is no short way for me to summarize both your remarks, but we hope that we lay our hands on those very rich statements that you've made so that we can share them much more broadly. At this point, I'm going to welcome, excuse me, Janet Midika from Wellcome, who is going to be moderating a panel that will be reflecting on some of these findings. Dr. Janet Mideka from Wellcome Trust, over to you at this particular point in time. And just because we are running behind schedule, would now give you 15 minutes instead of the 20 that you had asked for. Hopefully we can cover the subject comprehensively. Thank you.
Thank you very much, Dennis Adiano, and welcome everyone. And I must say that we at Wellcome are very, very pleased to see the launch of this report, and just want to say thank you to everybody who has participated, and also great to see the very strong support of the Ministry of Health Kenya in our efforts to tackle AMR, and indeed it's everyone's business. And so I'm very delighted this afternoon to be moderating this panel session with Dr. Evelyn Wesangula, Benjamin Avusevwa from the Kenya National Bureau of Statistics, and of course, Dr. Sam Akech, who is a principal investigator from the Kiambu Wellcome Trust program. So just to kick off our panel discussion, I will begin with you, Dr. Evelyn Wesangula. And I take note of the fact that you are a champion of antimicrobial resistance within the Kenyan government. And so what are these findings? What are these findings particularly meaning to you? Why are they so particularly useful to you as the Kenyan government in terms of your work in antimicrobial resistance? Over to you, Dr. Evelyn.
Thank you very much, Janet, for inviting me to this session, and indeed the bigger group of organizers. I'm glad to be part of this discussion today. And of course, as a champion in antimicrobial resistance, I'm excited at the event that we have now and the findings of the report, because many times we have spoken about things we knew, but these things were never documented. So having a report that actually shows what is happening in reality as a policy maker, as someone who sits in the policy making process and supporting the implementation process, I think the power in people's voices is something that has come out for me strongly throughout the process. I was part of the engagement, talking to the citizens and getting their views. So listening to people and taking into account their voices, their concerns, their solutions, I think from where I sit is one of the most powerful things that I'm taking home as a lesson. One, because many times in policy formulation, we propose solutions and we say these are our target audiences, but having the target audience internalize the problem, propose a solution, and be willing to be part of the implementation process, for me, is a mark of great success in terms of policy implementation. So just having to gather that actually the citizens are willing to be part of providing the solution to the AMR challenge that you're currently facing is a big step in the right direction. And the findings of this report are actually coming in at a right time when we are working towards developing our next policy and our second edition of the National Action Plan. So this gives us a different insight into the process. It helps us to understand how we can better shape the interventions and frame the narrative in a better way, knowing that many people now actually don't understand what antimicrobial resistance is. So I think it has been critical for us to get this kind of information. And like we said, it's the non-conventional sources of information and sources of data, which is actually rich and can actually go a long way in terms of informing actionable policies. Because many times you can have a policy which really is not actionable because the people who are supposed to implement don't understand what their roles are. They probably don't see themselves as part of the problem. But when citizens are engaged in a meaningful manner like we did, they see themselves as part of the problem, propose solutions, not just for themselves, but they've proposed very good solutions even for government to take up. And I think that's better than just having a top-down approach all the time. So I'm grateful that these findings have come out, and I'm sure the next version of our policy on AMR and our action plan will deliberately engage the citizens to get their views. Thank you, Janet. Over to you.
Excellent. Thank you, Dr. Evelyn, for that great contribution. And indeed, you mentioned that a lot of knowledge is not documented and there is power in voices. And of course, those voices always mean data. And that takes me to our next panelist, Benjamin Avusevwa, the Director of Statistical Coordination and Methods of the Kenya National Bureau of Kenya National Bureau of Statistics. So the Bureau of Statistics has been supporting the production of quality citizen-generated data. Benjamin, could you tell us what you're doing and why you see this as important to the Kenya National Bureau of Statistics? Over to you, Benjamin.
Thank you, Janet Midega, for inviting us to be part of this panel, and I think it is a very important one. And as the CS mentioned, that KNBS is incorporating is in charge of production of statistics, and, in terms of the official statistics for the country. So this is a very important question for us, and indeed KNBS has been supporting the strengthening of the alternative data sources to complement what is provided as official statistics. One of this is what we are now doing today. This is what the African Voices have done to generate this information. And this is what we are calling the citizen generated data, which we at the KNBS, we want to put to the fore. Why this is important to us is sometimes, often we have many data gaps that already exist in our data sets or statistics that official statistics alone may never be able to fit or fit. Increasingly, we are seeing these data gaps, such as the data on the informal economy, on governance issues, etc. This is where citizen-generated data comes in to help us help us to close the data gaps, but also allow us to interact with the producers of this data, and we also learn from each other. And this is why we are here to support this. Since last year, we have been working closely with our partners to develop a criteria for validating citizen-generated data, and this is included in our quality framework, which we call the Kenya Statistical Quality Framework, Assurance Framework, which will be launching later this year. This framework is for quality of statistics and is guided by international standards and practices, and we are very proud to include it into a CGD quality criteria in it. The CGD criteria, I should say, is among the first to be developed in this part of the world, that is Africa. And the Kenya National Bureau of Statistics is proud to do this. And indeed, we are told probably we may be among the first in the continent. And this is the main purpose, is to guide producers of CGD to ensure that the data they have can be considered for official reporting, and that acts as a mechanism to enable us to interact with producers of these statistics or data. Being among the first to do this, the KNBS to develop this, we are also in the kind of learning process, and that is why we keep on engaging, and we are very thankful to GPSDD in supporting us and Paris 21 to guide us in developing some of these criteria. So we are working, and it is very important to work closely with the producers so that we can be able to work together in this direction. In KNBS and the directorate that I'm leading, which is the statistical coordination methods, exist to build and maintain relationships with the producers' data, and we continue to evaluate the importance of data and statistics, which we call advocacy for statistics. And indeed, we are happy for this launch today, that this is a one way of also opening us to see that how now citizen data can be used. Thank you very much.
Thank you very much, Benjamin. And indeed, I believe that researchers in the room, such as Dr. Sama Kech, will be very, very aware of data gaps that exist, especially with regards to data that have been collected using the official research methods. And so this makes it very important to us that the KNBS is indeed considering to develop a quality criteria that will see citizen-generated data included in data in an official capacity. And so with that, I'll move over to Dr. Sam Akech from Kiambu Wellcome. And Dr. Sam, the AMR research community is a very relevant consumer and influencer of evidence, such as what has been presented today. So as a researcher, could you tell us what value that you see in CGD contributing to the research community?
Thank you, Janet, and I'm delighted to be among the panelists today. The findings that we are being given today are very relevant to those of us doing research in AMR. The citizen-generated data gives us insight into perspectives that we do not currently have. In most of the research we do a lot of counting. So for example, we may rely on statistics that, as has been mentioned by Benjamin, or from our own research, we generate numbers so we can describe how common antibiotic resistance is across the country. We can also usually be able to describe the type of resistance, how it's probably coming about in terms of how are the germs changing across the country, and how it's spreading. But then there are certain insights that we do not have that are provided with this citizen-generated data. So for example, it's not just enough to know the numbers as I've described, but often you want to know what actually explains these numbers from the citizen's perspective. And this is something that we do not have, and citizen-generated data becomes very important. For example, we see that people, this research has shown that people often involve in behaviors that promote development of antibiotic resistance. For example, sharing medicines, seeking antibiotics too early when they do not need them, or just buying them across the shop. But it also tells us that they often do this because they may not be able to afford to go to a doctor to get a prescription. So instead of going to a doctor and paying for a prescription, they prefer to go to get it from a shop. And also, the other thing that this research showed was that even in healthcare settings, sometimes people do not want to queue for a long time. So instead of waiting in the queue to get a prescription, they would rather think that they save time and go and buy it at a chemist. So you can see there are definitely challenges that promote that behavior for antibiotic misuse. So even when we are tackling from a regulatory point of view, where we say you can only get antibiotics from a prescription, but you find that there are also other challenges that are met by the patients. So this is insight that researchers do not have, and these results of this citizen-generated data project on AMR has given us. Because now we are starting to see that for us to address this, it's not just enough to do research the way we've been doing it, but we need to find ways of consuming this data that comes from the public, from the citizens, to find ways of actually tackling the problem of antimicrobial resistance in a wholesome manner, rather than from just looking at it from the traditional biomedical research. Thank you, Janet.
Thank you very much, Sam. And indeed, as you've mentioned, there are many factors and challenges that promote citizen behavior in terms of how they acquire and use antibiotics. And that practice and their behavior therefore makes citizen-generated data a very, very important source of data, which we can then use to fill the data gaps that we see. And so this brings me back to Benjamin, and I would therefore then ask you, Benjamin, what would you tell the producers of citizen-generated data in Kenya and beyond from the perspective of a national statistical office? What would you like to see in terms of how citizen-generated data is produced? For example, in terms of standards, quality. What are your views on what the producers of this data should do?
Thank you again, Janet. The Kenya National Bureau of Statistics, like any other national statistical office, is guided by the the UN fundamental principles of official statistics. These are these quality principles have existed for many years, and there have been revisions to ensure they're in tandem with the current practices. In our own way, we here in Kenya, we are working to ensure that we provide guidance to ensure that we provide the necessary stewardship and on the importance of producing quality data to guide decision making. For producers of citizen-generated data, I would encourage you to see indeed KNBS or the National Statistical Offices as a collaborative partner, because we can all work together to ensure we have data that can help us fill gaps where official statistics may never be able to fill. And we think that this is a way to encourage alternative data sources that are available there, even including the big data that could be available, so that we can be able to help in decision making. Some of these data that come through, like what we are now witnessing here, comes very timely, that we in the National Statistical Office may not be able to quite avail in time, or the resources that we have may not be able to take in. So when we partner together, this is very important to be able to see that we can move forward in helping policymakers to make the right decisions. I want also to realize that KNBS is very happy to continue providing guidance and support to producers of citizen-generated data. And we do not want to leave anyone behind. Those ones who want to come on board, we should be able to talk to each other, and we work with everybody to see KNBS as a good partner in this journey of producing good statistics for the country. Indeed, I'm very happy to see this kind of research on antibiotics resistance, which affects all of us. And this will also, on an individual basis, can also help us to make the right decisions and support our people. Thank you.
Thank you very much, Benjamin, for that contribution. And indeed, it would be the right direction to take for KNBS to be able to collaborate, particularly with researchers, in order to enable the incorporation of citizen-generated data into national data. And so that brings me back to Dr. Akech, the AMR researcher that we have on the panel. So Dr. Akech, given this work and the findings that we have been presented today, what will you in particular do in your work to promote the value of using citizen-generated data? Over to you, Sam. Sam, I think you're muted.
Sorry, yes. So one of the things that we haven't really utilized traditionally in the biomedical research is finding what is being said out there by the citizens. So the citizens generated data methodology has been used a lot in areas of governance, but in areas of health research, this is just an emerging field. But seeing that some of the findings that are coming here, especially hearing what the citizens think is the problem and what is really driving resistance in their own perspective out there, this is quite important. And the value of, currently the value of citizens-generated data is underappreciated. It's not as much as appreciated in the areas of health research. So for us in research, we need to find ways of actually using this data. Once we have data that is quality coming from the citizen-generated data approaches, we need to look for ways of actually using this data to address the immediate challenges that drive resistance and also makes resistance a big problem, especially in our settings. In research, of course, there are those things we still need to work on. We need to work on finding out new antibiotics, finding out ways, how big the problem is of resistance, and looking for better ways of addressing resistance. But when you think about without incorporating the citizen-generated data, then you see we'll not be able to address the immediate needs that we have. So as a researcher, really, it's to find out ways to access this data, look for the appropriate research methodologies to be able to incorporate this data to bring changes immediately to the populations that we work in. Yeah, thank you.
Thank you very much, Dr. Samakech. And so clearly from this conversation, we can appreciate the value of citizen-generated data in terms of using the data to inform action, using the data in order to cover the gaps that exist. And so, Dr. Evelyn, this brings me back to you as the champion of AMR in government. So following these findings, what then is the next for AMR? And in your opinion, how can citizen-generated data be useful in the government's priorities in tackling AMR? And as the champion for AMR in the Kenyan government, what will you do? What will you in particular do about this in order to ensure that citizen-generated data can be incorporated more into government AMR policy? Over to you, Dr. Evelyn.
Thanks, Janet, for that last question. I'll start with the last one. I think I have learned a lot over the last couple of months as we've engaged with the citizens. So as a champion, and now having the privilege of having gone through the whole work and also seeing the findings and internalizing what that means, one of the things that I will continue to do is continue to listen to the people's voices. I think that's one of the things that for me has come out so strongly, because sometimes you struggle to find a solution and it's right there with the people. So as a champion, I will continue to listen to the people's voices, not just the technical people, but now going into communities and listening to what the people are saying regarding the policies we are making and how we are making them. What makes sense for them, what doesn't make sense for them, that I will do. And I will continue to learn so that together we can be able to action the recommendations. And at the end of the day, when that happens, then the goal that we envision
Sorry, we have briefly lost you.
Within our policies will be realized. So, sorry, is that better now?
Yes, better now, and maybe just to wrap up a little faster for time.
Yeah, so what we will do at the level of the government with the Secretariat is to provide a platform to deliberately engage the citizens going forward in the policy formulation and implementation processes that we already have in place, so that we don't leave out this critical segment of the population that ultimately makes the decision on whether or not to take the antimicrobials that are being prescribed and how. Thank you, Janet. Over to you.
Thank you very much to all the panelists for your contributions, and very, very excellent contributions there, underscoring the value of citizen-generated data. And particularly most important is the appreciation of the fact that the National Action Plan will now, in its new revision, include the use of citizen-generated data as part of sources of data that the government can use. So thank you so much for your contributions to all the panelists, and I'll hand over back to Dennis for the last part of today's discussions. Thank you.
Thank you so much, Dr. Janet Midega from Wellcome Trust, and your respective panelists for those very important highlights. We're going into a very brief question and answer session. And we already have one question that's come from Ezekiel. And I'll direct this to Dr. Evelyn Wasangula. Do we have a policy at the national level on drug resistance? Very quickly on that.
Okay, thank you, Davis. I just want to confirm that yes, we have a national policy on the prevention and containment of antimicrobial resistance in Kenya. And this is a policy that has been jointly developed between the Ministry of Health and the Ministry of Agriculture, Livestock, Fisheries and Cooperatives, and also the environment as well. So yes, we do have a guiding policy. Thank you, Davis. Over to you.
Fantastic. And if the link, I don't know if it's publicly available, and if it is, then indeed it would be great to share it with the participants here before we wrap up. If not, we can always follow it up.
I will share the
link. Fantastic.
Thank you.
Great. Thank you so much. We do have a couple of comments. Lillian says that we need to think through the strategies for community engagement for promoting AMR awareness, engagement, participation, ownership, and sustainability. And that's quite spot on, Lillian. We at GPSDD do believe that including citizens in the conversations means two things. One is that they learn from information and participation. But number two, they're also empowered to take some form of action. And that's exactly what we are seeking. Ezekiel also adds that we need to invest in community AMR awareness, which the ministry has clearly highlighted. Dr. Kibia talked about the development of a communication strategy with the different stakeholders in mind. Cyrus, you've asked a question, what the percentage of resistance for a certain drug, in brackets, data generated from the lab, should a researcher recommend to stop the usage of that particular drug in the hospital in AMR research? And I would refer that question possibly to the researcher on the panel, Dr. Sam Akech, what the percentage of resistance for a certain drug should researchers recommend to stop the usage of a particular drug in AMR?
Thank you, Davis, and thanks, Cyrus, for the question. The answer is that we do not have 1% that would say that once you get resistance to this percentage, then you don't recommend the use. Usually, what we would suggest is that for every patient, really, before they are given antibiotics, they usually need tests to actually check which particular germs or bacteria they have, so that then you know which antibiotics they really need, or even if they need antibiotics in the first case. And then for the question for the particular percentages, a drug may be shown to have some resistance, so it may not be able to work for certain infections, or if you get infections in certain parts of the body, but it can still work for certain other infections. So there's no 1%, really, is that the treatment should be guided at individual level by the results. Yeah, thank you.
Fantastic. Thank you so much, Dr. Sam Akech. And we do encourage you to also reach out directly to any of the panelists. You can write to any of my colleagues who reached out to you via email, and we'll connect you to follow up on any individual queries that you may have. We do have Andrea Butcher, who's now finally convinced and has been converted to be a citizen-generated data champion. He says that, yeah, he's going to reassess his criticism of this form of data and what it can do for antimicrobial surveillance. Samuel Kimeo from Africa's Voices Foundation is going to follow up with you, so you can have a proper conversation on this. You can also find the AMR National Action Plan. The link has been shared by my colleague Karen Bett in the chat, so do make sure that you follow the link to access the National Action Plan. And at this point, ladies and gentlemen, we are getting close to wrapping up this particular session. If there is any other question, give an opportunity to one individual to ask that. But in the meantime, we are going to be making some closing remarks at this point. Thank you so much for joining us. We do appreciate all the remarks that have been made and all the questions that have been posted in the chat. keywords here. Everyone can and should be an AMR champion, because it takes all of us to tackle this particular issue in a multi-stakeholder way. We're really proud of the government of Kenya for the action you're taking and all the strategies that you put in place, especially through the National Action Plan. I'm sure there will be many countries across the region that will be willing and interested to learn from our experiences here. And that's a challenge to the Wellcome Trust, to foster conversations across the region so that other countries can also learn from Kenya, and we can work together to tackle this particular challenge. At this point, I'm going to invite Professor Sam Kariuki, who is the Acting Director General of Kenya Medical Research Institute, who have been very close partners and do a lot of work in this particular area, to give his closing remarks. Thank you so much. Over to you, Professor.
Thank you much, Davis. And let me start by recognizing the presence of our chief guest, the Chief Administrative Secretary to the Ministry of Health, for those very, very excellent remarks. Also, other Ministry of Health representatives who are here, Dr. Kibias included. And also, of course, I'm aware of also other members of very, very eminent people, including the Ministry of Health, also Wellcome Trust and others. And ladies and gentlemen, members of the fourth estate, ladies and gentlemen, we have seen and heard very profound statements regarding citizen-generated data. And there's no doubt in my mind that anyone who doubted the power of citizen-generated data will have really seen how powerful this is, to be able to show that we can look back to the people we serve as Wanjiko. We call them here in Kenya Wanjiko. These are the ordinary people on the ground, to know what are their needs, what are their challenges, how do they perceive issues that affect them, rather than prescribe things that we really are at the very lofty end of our suggestions, and then we really don't feel for them. I think this has been a very, very useful conversation regarding citizen-generated data. From where I sit, I think antimicrobial resistance is a pandemic. It is a growing pandemic, it's evolving, and the results, if not mitigated at this particular time going forward, will be very, very devastating. So it's upon us as stakeholders to take this issue of antimicrobial resistance very seriously, and to be able to plug all the holes that we have, all the data gaps that we have in whatever means we can be able to use. One of which, of course, we have just clearly seen that the citizens themselves can come up with data that is very, very useful for policymakers, but also for implementers, those stakeholders that need to know where best to intervene, particularly to control and prevent antimicrobial resistance. Let me again take cognizance of the fact that this kind of data would not have been obtained if we didn't have properly moderated systems and tools to collect that kind of data. So it's important, even as we look forward to utilizing data that we didn't have previously, or we didn't have means to collect them previously, that we do this in a proper manner, that we use tools that are quality controlled in order to make meaning to the data that we generate. And I'm very, very glad that the Kenya National Bureau of Statistics is also going to assist, especially public health, make meaning of the data that we have and the data that we plan to collect. So my parting shot is to really emphasize to all of us who are stakeholders in the area of antimicrobial resistance to take note of the emergence of this situation, that AMR is a pandemic and we must act now and act from all sides of how we must be able to address this issue from all perspectives so that we can be able to overcome this pandemic. And I'll end up there and then take it back to Davis with that parting shot. Thank you.
Thank you so much, Professor Sam Kariuki, for those wonderful closing remarks. Ladies and gentlemen, at this point in time, we've come to the end of this particular session. We thank you most sincerely for finding time to join us today. We're grateful to the Ministry of Health, especially led by the Chief Administrative Secretary, Dr. Rashid Aman, and all the different government agencies that would find time to join us here today. We thank you, Kenya National Bureau of Statistics, for the great work that you are doing and working in partnership with all of us. Would like to thank KEMRI for your amazing collaboration on this particular project. Africa Voices Foundation, we appreciate the amazing work that you did in generating a lot of this evidence in partnership with so many of your stakeholders across the country. And we look forward to continue working with you. Wellcome Trust, we appreciate all the support that made all this possible, and we look forward to engaging with you. There's a poll that has been presented on the screen. We really appreciate your feedback, ladies and gentlemen. If you could click on any of those options, we'd appreciate your feedback. That will go a long way in helping us to make future events even better. And at this point, I'd like to say thank you so much. Enjoy the rest of your day, afternoon, morning, or evening, depending on where you're joining us from. Bye-bye.
Antimicrobial resistance doesn't have a face. You can go and tell a story from a cancer survivor, and you can tell a story from a community that has lost people due to cancer. But when you cannot see it, because there's no patient who will walk through the door and you can say that's an AMR patient, you have to do a raft of tests, and it probably doesn't show.
AMR is a big challenge for every low and middle income country, including Kenya here. We're talking about failure of treatment of most basic infections that would have probably be controlled or managed through an antibiotic. The worrying trend that would need addressing is where us as humans contribute to the increase in antimicrobial resistance. And that's where we can intervene. There has been a lot of usage of antimicrobials, but the problem has been that nobody does in the lab test to say that this patient requires antibiotic, this one doesn't require. It's usually a wholesale use of antibiotics for prevention of secondary infections.
There is definitely a gap in terms of data. When you don't have concrete data, then making decisions becomes a problem. You cannot make policy decisions sometimes without local evidence.
The other issue we need to tackle, especially at the level of policy, is for us to be able to put money where our mouth is. We must be able to assign resources to tackle this problem of AMR. It's not just about the Ministry of Health, it's not just about the central government, but it's about communities, it's about counties, it's about health facilities, that they need to discover that dealing with AMR starts with me. It's a slowly progressing pandemic. And when it reaches the peak, we may not have alternatives at that time.